Advanced Medical Transport is here for our community. I'm excited to be here with the regional CEO, Greg Chance. Greg, so glad to be here with you.
Appreciate you coming. Thank you so much.
Yes, absolutely. I know that you guys do amazing work in our community. Obviously, you don't really want to be the one that people are responding to with Advanced Medical Transport, but let's talk about what it is that you guys do and who you are.
Well, we consider ourselves a very important part of the healthcare continuum. Obviously, we're standing in front of one of our emergency response vehicles, and AMT, since coming into the community in January, has assumed EMS operations not only here in Champaign-Urbana, but also in Champaign County, as well as Vermilion County. So we are a non-for-profit local company governed by a local board of directors, and so I report to them in terms of our business plan as well as our community efforts. But our primary mission is to provide pre-hospital health care. And that's something that EMS has been struggling with for a number of years in terms of our identity. If you looked in the past, in the 70s and 80s, it was our role to pick up a patient during an emergency situation and get them to the hospital as soon as possible. But we are pre-hospital health care providers, so it's important for patient outcomes that we provide highly competent clinical care while we're on the scene prior to transport. So we really want to emphasize that AMT is one part of a healthcare continuum in terms of ensuring positive patient outcomes here in the community during an emergency situation.
So there's several partnerships in order to make the work that you guys do possible. What would you say is the importance of being an organization that is so rooted and run by people that are actively in our community?
Well, it's important that we have a local board of directors that gives me direction in terms of what best works here in Champaign-Urbana or in Vermilion County. So I rely on them in terms of our role in the healthcare continuum, in terms of what types of resources should be invested, what type of personnel we should be hiring to ensure that we fulfill that mission and vision of the company.
Yeah, absolutely. It is so cool, too, to have an organization that is so focused on just supporting and helping the individuals in our community and their highest time of need.
And that's something we like to discuss frequently with our team. The fact that if you're in the back of one of these ambulances, it's probably one of the worst days of your life. So it's important that not only do we get to the scene quickly, but we're also providing highly competent clinical care, but also doing it in a compassionate manner. So it's a very stressful situation when you're in the back of one of our ambulances. So it's our job to make you as calm as possible while performing those necessary pre-hospital health care services to ensure, again, the best positive outcome for you.
What does it look like from the point of how a truck is maybe dispatched to an emergency situation? What does that look like?
Well, it's truly a system-based approach. Obviously, when you're in an emergency situation, we strongly encourage you to pick up the phone, call 911. That call is then received in the local community call center, the 911 call center, and then depending on the location, either an ambulance from AMT or an ambulance from our friends at Arrow would be dispatched to your location. And most healthcare emergencies, you'd also see our friends from the fire department show up to provide assistance as well. So depending on where you're located at the time of that call will dictate which type of service you'll receive, either from AMT or our friends at Arrow.
Absolutely. Well, you guys do very valuable work in our community. Thank you for that work that you guys do. Great to be here with you today.
Thank you so much for visiting us.
Absolutely. If you would like to learn more about Advanced Medical Transport, we'll connect you at our website, ciliving.tv.